So I'm Dr. Samruddhi Nanda and I come from Jaipur, from India, and I work at a government setup, that is SMS Medical College there, and I'm a pain physician, a practicing pain physician for the past 6 years. The diploma in pain management, the exam that I took, it's a very, very special exam and it's very close to my heart. I had been a practicing pain physician for the past 3 years before I chose to take up the exam. So there were a lot of knowledge gaps that I had while I was training and even while I was practicing. So when I decided to take up the exam, I think the gaps started to narrow down.
My name is Gustavo Fabregat. I'm an anesthesiologist and I devote my clinical practice to treat patients with chronic pain mainly. I work in Spain, and in Spain there is no standard certification for physicians that treat pain. So mainly majority of clinicians that treat patients with chronic pain in Spain, the background is anesthesiology, as like me, but of course pain medicine treatment of patients with pain is, I think in my opinion, is a very specific thing. And I was looking for like a certification that could boost my career and reinforce my knowledge about the treatment of patients with chronic pain. And I think that I found this in the EDPM diploma.
So my name is Mike But. I'm an anesthetist. I work as a pain specialist. I work in Poland, in the north. I work in 4 outpatient clinics. So my main job is pain treatment, interventional pain treatment. So I have decided to pass diploma in the Switzerland. The first level was the test. So I passed it on the Congress in the Switzerland. And because there was positive result, I decided to go through the second step, and that was oral examination. And I was successful after third attempt, but fortunately for me, the third attempt was successful, and I have the diploma.
So I took my first step in 2019 and the second step was in 2021. And after the exam got over, I started feeling very empowered because the knowledge gap started closing in and I felt like I could deal with the patients in a more holistic way. I think it's a very special structure of the exam. It's got 2 steps. It's got part 1, it's got part 2, which deals with the clinical aspect, and part 1 deals with the MCQ examination. So it's special because it's not only the preparation that leads you to think that you're more knowledgeable, but it's also the fact that so many expert faculties have put in their heart and soul into structuring this exam. So for all of the others who are practicing pain physicians, be it trainees or be it experts in their fields, I feel that this is an exam they would like to have in their kitty, so that they could have a more comprehensive knowledge of pain per se.
It's a balanced structure, yeah, in my opinion. So you need to demonstrate that you know theoretical knowledge, of course, in the part 1, but you also need to demonstrate that you have the capacity of the transition of this theoretical knowledge to the real clinical practice in the cases scenarios in the Viva exam. So I think it's a balanced way of examining the knowledge of candidates.
The most challenging was to decide upon which exam to take. So I chose this because I thought that I did not just want to be deft at the interventional pain practices, but I wanted to know my patient as a whole. So this gave me an edge over all of these exams, the other exams that I was planning for.
I remember being really stressed, just a little bit, not during the preparation, but just moments before, yeah? Because every time you need to explain others the things that you have studied or you think you know, you feel like challenged, yeah?
You just don't know what the question will be about. And about the oral part, so as I mentioned, you just may have a question about a very rare disease. So sometimes it happens. That happened to me. So I just didn't know too much about one of the disease, and that was the reason I didn't pass. So you need to know, not maybe in details, but you need to be aware of many different diseases which are not very common in some occasions. So you need wide knowledge, wide general knowledge.
Preparation, yes. If I would grade it from 0 to 10, I think it was 7, 8 on 10, and even the exam taking was pretty rigorous. I had to sit through the entire exam. So during my times there was COVID, and so I had to take an online module of this exam. So the entire examination process took I think 8 hours, 1 in the morning and 1 in the afternoon. So it was rigorous, and it was very, very satisfying at the same time.
So for each exam, I've prepared for 2 months. Exam is about my daily practice. The main problem is the language difficulty for me. So I had to learn how to answer in English language, because I'm from Poland. So I don't have many opportunities to speak in English. I had to learn about the symptoms and about all the treatment and the disease in English. But that helped me in my further career, so that was very useful knowledge for me.
Oh, I would highly, highly recommend. If there was something like 20 on 10, I would just give it all in. So 20 on 10, really, I would highly recommend, because I think that this exam gives you an edge like no other exam can. So it is good even for trainees, even for the experts, and because it gives you a holistic sort of an approach, I would highly recommend, yes.
Of course, I would recommend this diploma. It's well recognized in the Europe, I think in the world. So having this international diploma is a good proof of level of your knowledge and skills.
That should actually take you to a level that is at par with the world. So being from a developing country and knowing that there are different standards of pain management and other specialties in different parts of the country, I feel that European Diploma in Pain Management basically gives you a single standardized platform of grading and teaching you the finer nuances of pain management.
I think this type of certifications, in my particular case, they boost my career, because I think I'm a better physician after obtaining this. I think this really improved my way of treating my patients directly. Make me more confident in the things that I've been doing during the treatment of my patients in the last years. You feel like more secure, more confident, I think I can offer more safe procedures and safe medicine, and more qualified and medicine of more quality to my patients after obtaining the diploma.